and welcome to the Beat3.
This meeting is being recorded.
Beat3 and the Beat3 Network Information Session. My name is Loretta Lechman from the Key Accounts Department, and with me tonight I have a panel of experts that will assist me with your questions, should you have any, on the chat functionality. Also, we'll be having questions and answers after the presentation, should you have any. Without any further ado, let's start the information session of tonight on Beat3 and Beat3 Network. I'm going to switch off my camera just for network purposes, because I do find that I've got in between network issues and then the sound comes and goes. So if you do not mind, I will be switching off my camera. I'll switch it back on after the presentation. All right, just give me a moment to do that. Okay, on the agenda for tonight, we will be discussing your hospital benefits on both the network and the non-network options, PMBs and DSPs, chronic medication, how your maternity benefits work, preventative care, the Tempo program, and what's new for 2023 on the Tempo program. We will also go through your savings account, as well as the Bestmed app, how to download the app, what's on the app and how the app can benefit you, when you do make use of the app. Right, first on the list, hospital benefits, as I said. Hospitalization is unlimited. No overall annual limit is applicable here. We pay 100% scheme tariff. So if you are on the network option, you need to make use of our DSPs, meaning our designated service providers. This is our life hospitals and mediclinics. For those of you that are on the non-network hospital or non-network plan, you have to make use of, for those of you that are on the non-network plan, you've got access to any hospital of your choice, meaning that you are not restricted as with the people that are on the Beat3 network option. Also, what's important, treatment in mental health clinics are limited to 21 days per beneficiary per annum. Treatment for chemical and substance abuse are also limited to 21 days or 35,573 Rand per beneficiary, subjected to our network facilities. Maxillofacial surgery, limited to 14,256 per family. Dental and oral surgery, limited to 8,893. Internal prosthesis, your artificial disc was excluded from this benefit previous years and this year. For next year, spinal, including the artificial disc on single level treatment, is funded from next year onwards. Continuing with our hospital benefits, functional prosthesis has increased with 32,000 Rand, palliative care and home-based care in lieu of hospitalization. There it is funded at 63,420 Rand per beneficiary per annum, subjected to available benefits, pre-authorization and treatment plan. The same with biological medication and hospitalization, subjected to pre-authorization and the Bestmed funding guidelines. It is, however, limited to 21,140 Rand per family per annum. Day procedures at day hospitals or day at day hospitals will be funded at 100% of our network or scheme tariffs. If it so happens that you do make voluntary use of a non-DSP specialist and an acute hospital, please note that will result in a 2,500 co-payment. Also to take note of on the Beat option is joint replacements are excluded except for PMBs. Right, where to find our network hospitals or a list of our network hospitals on the Beat3 and Beat3 network options. You can visit our website. You will find a range of our hospital networks for you to choose from. In emergencies, a member can be admitted in any hospital, but as soon as the patient is stabilized, you will be transferred to your network hospital if you are on the network option. And again, voluntary use of a non-network hospital will result in a co-payment, as we can see, of 13,078 Rand. Right, hospitalization. Sorry, I just need to double click on here. Okay, forgot to double click. Right, for hospital authorization, important information is needed when you do phone us for authorization. Your member number is important, your dependent code, the treating provider's practice number, your hospital's practice number, the date when you are going to be admitted, as well as the diagnosis codes and the ICD-10 codes. Also, remember, you need to call us within 7 to 14 days for pre-planned procedures. Right, out of hospital benefits, scheme benefits, continuing. Out of hospital scheme benefits for diabetes, you've got 2 primary care consultations at Dis-Chem pharmacies, 100% of scheme tariffs, and do not forget to register with Halo Care for this benefit, to benefit out of it. Your scans out of hospital, you have 5,885 Rand for the family, also payable at scheme rate. Wound care at 100% scheme rate and limited to 3,885 Rand per family per annum. Rehabilitation services, PMBs and DSPs only, subjected to pre-authorization. Designated service providers. These are DSPs that's contracted with Bestmed, our doctors, our pharmacies and hospital that provide treatment and care for PMB services and other services. If a member uses a non-DSP, they may be liable for a co-payment. Therefore, the cost between the provider and the scheme. Okay, types of networks. So, DSPs or designated service providers, mostly PMB conditions are paid from scheme risk. Providers agree not to ask rates higher than the contracted or scheme rates, which are paid in full. In case of a PMB treatment, using a DSP will ensure a full payment. However, how are our service providers selected? Any specialist in good standing with the Healthcare Professions Council of South Africa and choose to join the Bestmed DSP network is welcome to do so. We do send out bulk invitations to these doctors to invite them to form part of our network service providers. And joining the network is voluntary. We do not force them to do so. It always remains their choice. And those that are viewed as best in the field or have a scarce skill we usually approach those directly and we personally invite them to join our network. And our non-DSP specialists preferred by Bestmed members are also personally invited to join the network. So if it happens that your doctor is not on our network, you are welcome to send us a request and we will invite your doctor to come and join us should they wish to do so. PMB procedures. If a patient or a member needs to be treated or cared for and any condition qualifies as a PMB, the member is required to make use of a designated service provider on the Bestmed network to avoid co-payments. Why do we do this? According to the Medical Schemes Act, a scheme is required to pay PMB at treatment at cost, meaning the invoiced amount. Schemes may form DSP networks, and where these are available, we reimburse non-DSP members up to the DSP or the scheme tariff amount, or which is ever less. If no DSP provider is available within a 50-kilometer radius of you, any provider may be used and the PMB fund will be funded in full. As long as you did not pass a DSP provider, make use of a non-DSP provider, you are welcome to contact Bestmed for guidance should you have problems, choosing or finding your DSP network provider. Right, in emergencies where a member did not have a choice or involuntarily had to make use of a non-DSP, the DSP rule will be waived and the PMB claim will be paid in full. Where to find your network provider? We have a variety of channels where you can find this information on our Bestmed website, the chat now functionality, the Bestmed contact center, or you can email us at service@bestmed.co.za. Also, you can find the network providers on our Bestmed app. If you wish to download the app, it is only to your benefit if you do download our Bestmed app. In cases that are very complicated and you have not received the advice, for example, that you need from us, if there is no DSP closer to you, for example, and you are referred to someone else, or you like your specialist, for example, and you trust them, but they are not on our network, and you want Bestmed to contact them. Also, if you are unsure of which DSP to use, please contact us or send us an email at specialist@Bestmed, and we will help you with finding your DSP or whatever your concern might be around our DSPs. Okay, the process for our in-hospital and PMB or PMBs, if it so happens that you do need to be hospitalized or admitted, please call us on our 0800 number for your admission. Your accounts will be paid at the Bestmed tariff, and if you have a valid PMB, the practice, or you can apply to have the shortfall paid from the PMB if there was any shortfall. So do remember to give us a call should you not be sure whether your condition is PMB or not PMB. We are here to assist you. The pre-authorization number is 0800 22 0106. And our contact center number, as you can see, 086 000 2378. Going on to our medicines. Right, we've got 27 CDL conditions on the Beat3 option. 18 PMB conditions are covered and 5 non-CDL conditions. Okay, treatment specified in the treatment plan, general treatment that an average patient requires in the treatment of the condition. They are prescribed, that they should be prescribed by, the treatment will be, prescribed by the treatment protocols. So remember, in the back of your brochure, if you do go and have a look there, you will find your 27 CDL conditions and also your PMB conditions, what they are, as also the additional 5 CDL conditions that you have to your disposal. Here is your CDL conditions. Addison's disease, for example, coronary artery disease, for example, epilepsy, HIV/AIDS, hypertension, and the list goes on up until 27 conditions, as I've mentioned. Your non-CDL conditions. You've got acne here for your non-CDL conditions. You have ADHD or ADD, allergic rhinitis, and eczema. On the 5 non-CDL conditions that are covered, okay, your CDL and PMB conditions are unlimited. Your medicine benefit for your medicine benefit for non-CDL conditions are limited to 3,793 Rand for a single member, a family 7,716 Rand, 20% co-payment if you make use of the formulary, our formulary, 30% co-payment if you do not make use of our formulary. The formulary is available on the website, so I do suggest what you do is when you go and see your doctor, that you might take a copy of your formulary and present it to your doctor so that your doctor can prescribe your medications that is on the list provided. What is important to note as well, your approved CDL, PMB, and non-CDL chronic medication cost will be paid from this limit first. Thereafter, approved CDL and PMB chronic medicines will be paid or will be continued to be paid after this limit is reached. Approved medicines for organ transplant, chronic renal failure, hemophilia, and multiple sclerosis are not subjected to the chronic meds limit, but are paid from risk. Your acute medication, how this works. So what is acute medication? Acute medication is prescribed medicines that does not form part of your CDL, non-CDL, or PMB conditions. Your acute medications are paid from your available savings account at the Medisco reference priced tariff. Over-the-counter medication is also paid from your savings account. It shall be paid at 100% of the scheme tariff. And your OTCs includes things like vitamins, minerals, sunscreen, but it is subjected to the NAPI codes that is on our formulary. Biological medication during hospitalization is limited to 21,140 per family for the year, also subjected to pre-authorization and funding guidelines. PMB biological medicines for CDL conditions are considered as last line treatment if strict entry criteria is met. Okay. Right. So what is CDL or chronic, or what is the chronic disease list? It is the medicine and treatment for the 27 conditions that the scheme must cover as per legislation. Treatment must be provided according to the standard treatment algorithms for each CDL condition. The process to get your medication or your chronic meds approved. Your doctor, and you must complete the chronic application form. We do advise you to download the medicine formulary once again and to present it to your doctor so that you can avoid co-payments. New members can submit their chronic letter and a latest prescription not older than 6 months for registration. You can email that information to medicine@Bestmed and we will handle it from there. Also, what is the difference between the Beat3 network and the Beat3 option? The Beat3 network, it is recommended that Beat3 network members make use of Bestmed pharmacy networks. The Beat3 non-network members, they have freedom of choice. They can go to any service provider or pharmacy of their choice. These pharmacies are committed to providing cost-effective medicines at competitive dispensing fees, and the dispensing fees are also kept lower than the non-network pharmacies. A list of these pharmacies, you can find it on our website. They are usually Dis-Chem pharmacies, Clicks, Van Heerden pharmacies. There you will find that these pharmacies will not charge you, exorbitant fees or unnecessary co-payments that should not happen. Right, what is required for you to register your medicine on chronic? First-time applications, you must complete and sign your application form. Supporting information is very important also. Otherwise, your application form will take longer than usual to be approved. New medicine added to an existing authorization or to update an existing authorization, we need a copy of your new prescription, please, as well as supporting information. And please email this through to medicine@bestmed.co.za. We also have telephonic authorizations, which you can speak to any of our pharmacists that are online that day. So if you do have queries around your prescription and you're not sure what to do, you can phone us and we will contact you. You can phone us, and we will explain to you what to do. Okay, medicine relating to PMB. Okay, PMBs are a set of minimum benefits which by law must be provided to all medical scheme members and include the provision of diagnosis, treatment, and costs going on or ongoing care. PMB conditions that we have set is 18 covered here on the Beat3 option. They are aplastic anemia, cerebral palsy, COVID-19. Number 18, we see there is stroke. Number 8, endometriosis. So these are your PMB conditions, which by law we are obliged to pay. Formularies and co-payments. All Bestmed formularies for CDLs, non-CDLs, and PMBs are available on our website. It is also available on your Bestmed app. CDL and PMB conditions, your co-payments for formulary items, there are none, but the medical reference price applies. Items not on our formulary, you have a 30% co-payment. Formulary medicines is not automatically approved. pre-authorization is very necessary to have your medication approved. What can be done to avoid your medicine co-payments? As said before, download or print our formulary, which you can find on the website. Use generic medication. Also make use of our DSPs like Dis-Chem, Clicks, and Van Heerden pharmacies, as well as Medipost. Right, some fancy stuff here from our medicine department. Okay, an SMS notification we will send to you once we've received your chronic application form. Also, when your chronic application form has been approved, we will get an SMS also. When your script expires, you also will get an SMS that will tell you to please send us your new prescription, a real-time SMS at the point of claim. So when you're at the pharmacy, you will get an SMS also for non-formulary medications that has a co-payment. Also, if your acute medication, we see that you have claimed for your acute medication on a continuous basis for up to 3 to 4 months, we will prompt you and also tell you that this is a possible chronic medication. Please inquire with us and get this medication authorized. Okay, sorry. Your PMB registration. Download your PMB registration form on our website, or you can ask one of our key account consultants, email them or phone them should you need a PMB application form. Send this after completed by your specialist to pmb@bestmed.co.za. And also important to note, designated service providers applies to our network option. Or actually, it actually applies to the designated service provider, applies to both network and non-network for your PMBs. Okay, maternity care. You have 9 antenatal consultations at a family practitioner or gynecologist or midwife, any of your choice. You have 1 postnatal consultation after the birth of the baby. Also 2 scans, 1 in the first trimester, 1 in the second trimester, also by your family practitioner, gynecologist, or radiologist, whichever you prefer to do your scans. And then you've got 9 fills of supplements at 127 Rand per month. So those of you who are planning on having a baby, there is some fantastic benefits for your maternity should you decide on or plan to have a baby. Preventative care. You have access to 12 preventative care benefits. Here they are: flu vaccines, pneumonia vaccines, travel vaccines, female contraceptives, etc. I'm not going to go through the entire list. This you can find at the back of your brochure as well. Please consult the brochure to see what preventative care benefits you qualify for. The Tempo program. What is new for next year? Okay, as we know, for your Tempo program, you have to go for your health risk assessment at any Clicks or Dis-Chem pharmacy or at your wellness day at work. Then after you've done your health risk assessment, you get your results from us on email, or you can get it on our Bestmed app. After you received it, then you can decide what you want to do about your results. But what we do have for you is 2 consultations with the biokineticist two consultations with a dietitian at your disposal. And for 2023, or we actually have started with the emotional well-being program already in October. That is new on our Tempo program. It provides you with an emotional well-being journey, and we also have preventative care benefits such as screening and vaccinations on our Tempo program. More about our emotional well-being journey. Okay, so the emotional well-being journey is something new and something very important that we have decided, all our Bestmed members do need, and their families, seeing that we've been through so much during the COVID time and even our current circumstances. We do need some kind of emotional assistance. We always sit and think that we don't have all the answers, or sometimes we think we do have all the answers, but our emotional well-being program has been designed. It is a healthy mood program, okay? It provides you with a platform for you to make you aware of your emotions, to accept your emotions, and the ability to effectively navigate through life's challenges and the changes and curveballs that life throws at us. It also helps us with understanding our emotions, what we can do about it, and how we manage our emotions. The emotional well-being program will also allow you to increase your confidence, have a better mood, and also be content with yourself. You can download this information on our app. It is on the Bestmed app. So if you'd like more information on this, please download it. It is to your disposal. Right, where to find the Bestmed Tempo service providers? Like I've said, you've got 2 dietitian consultations and 2 biokineticist consultations. Go onto the Bestmed app, and then you will go to find a service provider. Then you click on I want to find, then you click dietitian or biokineticist. I stay in Gauteng, I stay in Cape Town, and then after that you click on your suburb where you stay in. I live in Boksburg, I live in Benoni, I live in Pietermaritzburg, for example. Then you click on that and click on search, and it will throw you out your nearest service provider where you can make a phone call, and they will assist you to make an appointment for you online or face-to-face, whichever you prefer. Okay, on the Bestmed app, you will need to go on My Wellness. Okay, so, sorry, not on My Wellness. On the Bestmed app, on our website, you first go to the member portal on the website, then you click on Member. It will throw you out the main menu. On the main menu, you choose Emotional Wellbeing. This will take you to a library of information, like on the second screen here attached, such as, information. There's a lot of information like articles, topics, and even quizzes that you can participate in on this platform. It also has recordings for you to listen to. There will be support groups and live events shared on this platform. Also to note is you will have access to a network of psychologists to pose your questions to, should you have any questions. There will also be group sessions and online sessions and invitations that we will send out to you that you can attend, and we will send you, like I said, invitations so that you can attend these sessions and be well informed on your emotional journey. Right, our annual savings account and contributions. What our savings account is all about. All right, so your savings account is 15% of your contributions. Okay, this is for all your out-of-hospital needs such as doctors, specialists, consultations, optometry services, pharmacies, radiology, and pathology. These are only the basic services that I've mentioned, but anything and everything done out of hospital, this is paid from your annual savings account. To note, we only pay at scheme tariff, and if your doctor charges more than the scheme tariff, you can have the excess, that excess amount paid from your vested savings, or if you do not have vested savings, you will have to pay them out of your pocket. Here we have your annual amount on your savings account. If you can have a look at that on the screen. Beat3 annual amount for single member 6,128. Adults, 2 adults and 2 adults and 2 children, 14,808. Annual amount member plus spouse, 10,488. The network option, 5,628 Rand. 2 adults and 2 children, 13,632. And then you have your annual amount for the family as well. Contributions, principal member, 3,128 Rand on the network option. Adult dependent, 2,231. Child dependent, 1,104 Rand. Non-network option, 3,400 Rand. Adult dependent, 2,425. Child dependent, 1,200 Rand. This you can also find in your brochure should you need more information on that.
Can everybody see my screen? Okay, the Beat3 savings account, one of the changes that we made was that we reduced the savings from a Loretta, you must just now mute yourself, please. Then one of the changes that we made was that we reduced the savings account from a 16 to 15%. And remember, another change that we made to the Beat3 is to take the optical benefits out of scheme benefits, and it will be paid in future from your savings account. Now, the reason why we've done that was basically so that we can lower the cost of the product, so that it get closer to Beat2, because the gap between Beat2 and Beat3 was too high. And what we realized was that members will, when you outgrown B2, you will leave the scheme and then come back again when you can afford base 1. But B3 didn't really grow, and we knew that we had to reduce the cost. So you will see in the beginning we've shown you that we've increased the fees for the adult, the principal member on B3 with a 5%, and the adult dependent on B3 network with a 7%, and then we've reduced the child dependent fee. And the reason why we've done that is basically to make it cheaper, so that it be closer to B2, and we want to stimulate then the growth. But as you know, if you want to make something cheaper, you need to let go of something. And what we had to let go of was the savings account, yes, 1%, and then also the optical benefits that will be paid from your savings in future. Remember that we change our rules from this year 2022, that all dependents up to the age of 24 pay a child dependent fee whether they're a student or not. And we did that because we know socially that it's hard for young people to get employment, and they stay longer with the parents. So your child will pay a child dependent fee whether he's a student or not until the age of 24. And when you submit proof that he or she is a student, then that age increase to 26. Then Loretta did speak about the Bestmed app, but it's really an excellent tool. If you download it, you will see that you can see your benefits on what you have in the beginning of the year, what your amount was, what you used, and what is left. You don't need to phone to confirm benefits. You have it in front of you. You can take a photo and send a claim through. Even your tempo, all the journeys will be on the app. So it's very important that you download the app. But if you are like me, I struggled. I think I've later on, every time I phoned the call center, I gave another name so that they don't realize it's me struggling. But at the end, everything is working. So please download the app, because it's important for you to have access to your information 24/7. New members, if you did not yet receive a card, there's an electronic card on the app, and you can use that. Now, I know that we've shared a lot of information with you about how Beat3 and how it works, but if you have any question, you're welcome to direct that at your key account consultant if you know who that is for your employer group. Or if you don't know, you can send it to escalations, and Katlego will forward it to the right person and make sure that you get an answer. Do you have any questions? I think it's the only slide is my thank you. So are there any questions of anybody? Then you can just raise your hand and we will give you time to speak. I'm just making sure. Marianne en JR van der Merwe.
Hi, good evening.
Good evening.
How are you?
Very good, thank you.
I just got a question. I was hospitalized in September for ileostomy in Cape Town UCT Medical Center.
Yep.
The hospital account, there was a retractive that was not paid. Do you give the specialist a list of what instruments they can use in the theater?
Okay. I think, Marianne, the best would be if I tell you that 70% of our queries, no, I'm not allowed to say that, but a lot of our queries are about differences between hospital bills and the amounts that we pay. So I think it's best if you send your member number to me. My email address is just elmarie.jooste. It's just my name and surname with a full stop in between at bestmed.co.za. What I will then do is discuss it with the manager in that department. What we usually do, and everybody need to listen carefully. When you're in hospital, they will submit an account, the hospital will submit the account to Bestmed, and then we have auditors, that go through those accounts, and sometimes they claimed for 5 sets of gloves. It's now a stupid example, but take it. 10 sets of gloves, but there were only 4 people in theatre. Then we will send it back, and then we will say you can't claim it. You need to amend the account. That is first thing. Then what we've realized is, instead of amending the account, the first thing that they will do is they will forward it to the member. And the older you are, the more anxious you get. I've realized that through the years. And if they start threatening you with, the debt collectors and stuff, then usually members pay it. But the same letter that we send to the hospital by saying you need to amend the account, we also sent a copy to you. And you will see, if you open that account, then we say member not liable, member liable, or member not liable. But most of the items are members not liable. That means that there's a mistake on the account. That is the first thing that everybody needs to know. Please, please, please. You do not pay something after hospital procedure if we didn't explain to you why you need to pay for it. Then the second thing is, the rule apply, or we have a policy in Bestmed that the scheme need to inform you in advance of something that we will not pay. So you need to be aware of it. And sometimes it's in the contract that we have with the specialist, or it's in the contract that we have with the hospital, that it's an exclusion. Then we might not tell you, but it's part of the contract. Then they can't, they can only claim for it once they've warned you that they're going to use this and your scheme doesn't pay for it. If none of this happened, then we need to talk about it. So that's why I ask, please send me your member number so that we can follow up on it.
Thank you very much. I'll do so.
Pleasure. The next is NB 129579. It sounds like a student number because I have an email address that's similar.
Hello, it's Cecilia in training here. You're picking up my work reference number. Yes, yeah. I'm with Nedbank. So it's just that I looked in the chat as well, and it's the same issue Gerda placed. She said, you just replied, we do have comparison brochures on all the options, because she was asking for the option between the difference between PACE 1 and Beat3, if there's a comparison available. And I just want to know if that can be made available easily.
Yes, we can
or maybe I must just wait till you have a Nedbank one. I don't know.
No, we do have what we've done with these sessions is we've grouped, because most of the, I'm going to say, Nedbank members are on Beat 1 and Beat 2, and because the majority are on those two options, we have that and Beat 3 separate, and then we combined PACE 1 and Beat 4. So the next session is those two options because they're very close to each other.
Yeah, because before PACE 1 and Beat 3 was quite I found it quite similar when I did the comparisons, but PACE 1 was obviously getting you a little bit extra. Sorry to interrupt, but I'm going to be a pensioner next year, and the price of PACE 1 has gone up quite a bit. And so, in fact, it's the beginning of next year. And so was looking at dropping down to Beat3 because I took medications. I asked my doctor at the time to give me Beat3 medications. But now you've sort of dropped the benefits on Beat3 and made it closer to Beat2. So we've kind of lost some benefits from what I can understand. from
The only
B3.
thing that we dropped was the glasses, so you can't see, but you will have your medicine still.
Yeah.
So,
Well, the can't
yeah.
see is a big issue for me. So,
What we can do
yeah.
is you can ask for a comparison between Beat3 and Pace 1. And
Okay, because I see
send it
somebody
to
else has
me.
asked for exactly the same comparison in the chat. Would I need to add that again as well by myself? There's
No,
a
we can just make.
Marika Chain Dickens has asked for it.
Okay, Lida, can you write down all the names that asked for it, and then we can just email it to them?
Will
it
do,
be possible?
Elmarie.
Dankie. Okay, we will send it to you, but I'm not allowed to use the word moesje, but there's a huge difference between Beat3 and Pace 1 in
Yes,
terms of benefits.
just
okay?
listening today, I see how much it has changed from last year.
Yeah, but last year it was also, that's why we couldn't sell it. It didn't grow because what you pay for Beat3 compared to what you pay for Pace 1, you get kind of double on Pace 1 for 1,000 rand more. You understand?
Yes. No.
Yeah.
I did understand that, but I mean, I've just noticed that your premium on Pace 1 went up quite a lot this year.
Compared to B3, because remember, all our options went up with 8.9%, except B3. B3 went up 5%, the normal one, and then 7% the network. And then the child dependent dropped. We reduced that amount.
Yeah, I know when I listened to the Pace one, the lady did recommend that I think it was actually you that was doing the presentation, recommended it's a better overall sort of benefit,
Yeah.
let's put it that way, without being,
But we are.
you know, the extra bit is worth the money because it covers more, a lot more.
Yeah. What are we
But yeah, just because I'm going to be a pensioner, you know, you start looking at cost and what you can afford.
Exactly. Are you now on Pace 1, you said?
I'm currently on Pace 1, yes.
Right.
So, yeah.
When are
But,
you
you know,
retiring?
I'm assuming that Bestmed is going to do Nedbank presentations as well.
Yes, we did today, and then they will record it, or they recorded it to put it up somewhere.
We didn't even know about the one that you did today for Nedbank.
Hi. There's another one, the 29th.
Is that for for which one?
For all the options. It took
For
me
all the
time.
options. But are you doing separate ones as well or not?
No. I don't think so. I don't think so. Keegan, are you in the call, or Gary? But
okay, I'm sorry. I know this is now business work thing, but I become a pensioner next year, you see, and then I become halfway through the year, I become an independent person. So that's why I wanted to join these calls as well, because then in the future, I would actually be having to do these calls. I wouldn't be part of the company's
what we can do
things.
Is we're going to place Beat 1, Beat 2, and Beat 3, all the recordings on the website, and then you can listen to it.
Okay, that's a good thing. So I just go to www.bestmed.co.za.
Yeah, I'm not sure exactly where it is, but as soon as it's edited and they took out my swear words, then they will place it on the website. And but in the meantime, send me an email and ask me all your questions.
Okay, all right. Thank you so much.
It's a pleasure.
Let me lower this hand. I don't know. Can you mute me because I can't find the thing?
There you are.
Thank you.
Okay. Anybody else with a question? John?
Can you hear me?
Yes.
Okay. When you did the presentation, we're discussing scans. Is the annual benefit?
Sorry, I couldn't hear your question. Did you ask the benefit for scans? Is that in hospital
Annual.
or annual? Yes. It's annual.
Okay, it's just that the next sentence was said annual, but that one didn't, so I just wanted to specify on that part.
Yeah.
Um,
No, it's
then,
annual.
then just one other question. If you go to one of the network provider hospitals, do you control, for instance, if you have to go for an operation, the anesthetist's rates as well?
Unfortunately, you need to. He will come to you 3 minutes before the procedure, and then he will ask whether you have gap cover. Usually. So, but we have anesthetists on our network. But you don't choose an anesthetist always. It's
Exactly.
mainly the specialists that choose that
Yeah.
specialist. My recommendation would be, and I say this as a member, see why they need to edit the presentations always. Say to you as a member that you need to look at gap cover. I know OMI, your sister company, has a product that will cover the difference between the specialist consultation fee and then the scheme tariff in hospital. And it's not that expensive. I know that there's products in the market that's less than 200 Rand a month. Look at that because it might help you in future. But we do have anesthetists on our networks. But the reality is you don't choose it. The specialists choose one.
Yeah. No, thank you very much. I'm currently with TRAs. Are they okay?
Oh, yes, that's me. I'm also with them. So that's 100%. Then you covered.
Thank you very, very much.
Okay. See, we're not allowed to market any of the gap cover products, but I know that the plus, yeah, let me do it and get it over with. The positive about TRA is our systems are integrated. So if
Okay.
you're in the hospital, we will send the money, we will send the information to TRA that there's a difference in payment between the specialist and our fees, and they will send the difference to you, and you settle the account with the specialist, which is easy because then you don't need to submit claims and do the admin.
Perfect. Thank you very much.
Pleasure. Was there another hand? Sorry, Loretta, I took over your session. Jason?
Hi, Elmarie. Just what does TRA stand for?
Total Risk Administrators.
Total Risk Administrators. Thank you.
Yeah.
And you should do all the presentations. It's just been fantastic.
Thanks.
That's it for me. Thank you.
Thank you. Good. Anybody else? TMS user. Ooh, you have strange names tonight. TMS user.
Hello.
Hello.
Hear me?
Yes, we can.
My name is Gloria.
Hello,
I've
Lily.
got a problem here with my eyes. Ne? I understand I'm allergic to some plant whereby this allergy starts in Feb and also comes back in September. My eyes, they change. Sometimes it's the left one, sometimes it's the right one. And they become so red and so painful. And then I kind of got an eye specialist that I attend to, and she is so expensive. So by September, my medical aid is already exhausted. So I just want to know how do I deal with that? What is it that I can do so that I could be able to have enough savings,
Yeah.
for all my
On which?
treatment. I'm
Okay.
also on chronic medication for hypertension. And
Okay.
then sometimes I would like to go to the dentist. And then by the time I realize that I've got another problem, then the medical aid is like no more savings.
Okay. On which option are you currently?
Beat3.
Sorry, I didn't hear.
I'm on Beat3.
B2. Okay. I'm so
Beat3.
glad your dog bark at the back. Because a few weeks ago I presented, and when the boss was in the audience, my Jack Russell also barked, and I couldn't get
Yeah.
the,
Okay. I'm on
the
Beat3.
okay, B3.
Yes.
First of all, I think it's now I'm not a medical advisor of anything, but I get asthma on certain periods in the year, but then the other
Yes.
periods nothing. So it's allergic something. So I qualify for chronic medicine because I get asthma as a allergy during certain seasons. So I'm not sure whether it will work, whether it work in the same way if your eyes are affected, like you say. Um, that is first of all. But I know that it is kind of a allergy, so there might be medicine that you can take, or isn't there any medicine that you can take?
But the medication that I take need to be prescribed
Okay.
by the specialist that I go to, and it is expensive. Like
Okay.
I use 2 different types of the drops, and
Okay.
each one is about, like now the one that I bought is 275 each. The other one is 230 something. So it comes to 500 and something, and the consultation on its own, it's 1.2. You know,
It's more expensive than a gynae.
you see.
Yes. Rulin, or anybody of provider relations, are you here?
I beg yours.
No, I'm talking to my panel. Is there
Oh,
anybody of provider relations here?
Ria's here, Elmarie.
Okay, Ria, do you know whether we have, I think they call those eye specialists something. Do we have those on our network? Okay, Ria. Ria also have, yes.
Yeah, sorry, we're having a huge storm, so yeah, the connection isn't very well. How can I
Okay.
help?
Okay. She has and then I need a medicine person. So I'm not sure who's here from medicine department. But do you think the medicine will qualify as allergic rhinitis medicine?
are you talking to me now?
I'm talking to the medicine person
Oh,
on the
okay.
panel. Sorry. Okay. Gloria, you said your name is Gloria. I think
Yes,
it's
yes.
best because the sound is in places we have a storm, so people can't like hear us. Can you send me your member number so that I can go through your claims and see who's the specialist that you use, and then see what medicine you claim, and then I will speak to Vanessa at the medicine department and ask her whether, because we can do 2 things, or we need to do 2 things. First of all, it will be a win if we can register your medicine as chronic, because then it doesn't come out of your savings.
Okay.
Okay?
Can I give it to you now? My medical aid number?
Yes, you must hope I get it tomorrow. Yes, you can give it to me.
It's 1962
Yeah.
652
Yeah.
19.
Okay. 1962 65219. So
Yes.
that will be a win if we get that. And then the second thing that we need to do is try to see, to get your specialist on the network so that her fees are equal to our tariffs. But it will
Okay.
still be coming out of your savings, but you will save on the medicine, which is
Okay.
already a win.
Okay.
But let me go through your stuff and then we will give you some feedback.
All right. I will appreciate that.
Pleasure.
Thank you so much.
Good, good.
Okay.
Anybody else? Not even a Kutsia. You know, I don't know Kutsias is quiet. I'm born a Kutsia. We're not quiet people, silent people. All right, then, ladies and gentlemen, half of the audience left already. So thank you so much, and thank you, Loretta, for presenting. I think it's Gary's in Refuwe's place, because Refuwe fell ill, then Gary fell ill, then Loretta had to stand in, and then the sound dropped us and I stand in. But there's a reason my camera is not on, because I'm not presentable at this stage. So thank you so much for attending the session, and please send your questions through. You have everybody's email address. Make use of it, and throughout the year, not only now, but throughout the year, you will note that we have member engagement and these information sessions that we will tackle certain topics. So we will, I know that PPN, the optical benefits, are one of them that is done in future, and then medicine, I just need to convince them again. And then the network people will have a session. So we pick processes after we've done with the product. So it's just to explain it better to members how it works, and then we found that there's less queries and people are more happier if we do it that way. So in the beginning of the year or the end of the year, we do product sessions, and then as the year start, we will start with the processes, and that will help you as well. So thank you to the panel who answered all the queries. Diresh, for you and your team, thank you so much for helping out. Have a good weekend, everybody.
Thank you. The same to you.
It's still far, but we need to just hang in there.
Thank you, everyone. Thank you for assisting tonight. Thank you, Almarie, for taking over when my screen froze. Good night, everyone.
Night.